Hey everyone, and welcome to today's Explainer. Today, we're focusing on a deeply important topic, understanding and preparing for both the medical and the emotional realities of ovarian cancer. We're drawing directly from the clinical insights of gynecologist Dr. Yoshi to look closely at what actually happens as this disease progresses. Now, I know this sounds heavy, but understanding this journey, that is exactly what empowers patients and families. It replaces that paralyzing fear of the unknown with real preparation, letting people focus on what truly matters. Okay, let's dive into this. It's incredibly common for patients and their loved ones to hold on to this exact thought. Once the chemo is done and the scans are clear, I'm completely cured, right? I mean, it's a totally natural hope, but with ovarian cancer, we have to gently challenge that assumption so we can properly prepare for what lies ahead. Because the harsh reality and really the defining characteristic of this specific cancer is its high tendency to recur. So here's our roadmap for today. First, the reality of recurrence. Then, the emotional toll on families. After that, physical signs of progression, followed by managing pain and symptoms. And finally, the power of early prevention. While we're tackling some heavy medical realities today, our ultimate goal is to arm you with the knowledge you need to protect yourself and your loved ones. All right, let's start with Section 1, the reality of recurrence. To truly understand ovarian cancer, we really have to look at its behavior. The hallmark of advanced ovarian cancer is its tendency to spread extensively, often right throughout the abdomen, and its stubborn tendency to repeatedly return, even after what looks like a totally successful initial treatment. The timeline of this disease can be incredibly grueling. A patient might undergo surgery, maybe 6 months of chemotherapy, followed by a really hopeful year and a half of remission. But then the cancer comes back, they have to go through another 6 months of chemo, maybe they get another year of remission, and then it recurs again. This exhausting cycle of recurrence and remission explains exactly why patients and their families get so physically and emotionally drained. It is just a relentless roller coaster. Now, here's a pretty surprising fact from Dr. Yashi's clinical experience. When we look at other gynecological cancers like cervical or uterine cancer, there actually aren't that many effective chemotherapy options once the cancer returns. But ovarian cancer is very different. Doctors actually have many evidence-based chemotherapy weapons available to them. And, on one hand, this is a wonderful thing. It creates hope, it shrinks the tumors again and again. But on the other hand, it's precisely what prolongs that exhausting, repetitive cycle of treatment, temporary recovery, and heartbreaking relapse. Which brings us to Section 2, the emotional toll on families. Ovarian cancer typically strikes women in their 40s and 50s. That's often the absolute peak time of life when they might be raising kids, managing busy households, and really serving as the anchor of the family. So the ripple effect of this illness touches literally everyone in the home. Just imagine a young child or a hopeful spouse in this situation. After that first brutal round of surgery and chemo, when the doctor says those scans are clear, the absolute natural instinct is to think, Mom is better, she's cured, we're safe now. It is completely understandable to want to believe that one round of remission equals a permanent cure. But when that inevitable recurrence hits, the emotional whiplash is just absolutely heartbreaking for the family. And that is exactly why mental preparation is so crucial. The core goal of sharing these medical realities isn't to cause despair, not at all. It's to help families mentally prepare so they aren't totally blindsided by a recurrence. When families understand the big picture, they can actually process that emotional whiplash so much better. Instead of being paralyzed by shock, they can focus all their energy on spending their precious time together, wisely, supportively, and meaningfully. Okay, moving on to Section 3, physical signs of progression. I do want to offer a gentle warning here that we're going to discuss some of the specific, late-stage physical symptoms of this disease. It's tough to hear, for sure, but understanding what happens to the body is a really vital part of supporting a loved one with genuine compassion. As ovarian cancer progresses, or maybe after critical lymph nodes are surgically removed, there are 3 major physical symptoms that often show up. We call these the big 3 late-stage challenges: severe lymphedema, ascites, and pleural effusion. Let's break down exactly what each of these means for the patient's day-to-day life. First up is lymphedema. Because the cancer and the surgeries disrupt the normal flow of lymph fluid and blood in the pelvis, patients can experience extreme swelling in their legs. And we aren't just talking about mild puffiness here. The swelling can become so severe that the legs become incredibly heavy. Simply walking or even just fitting comfortably into a wheelchair can become tragically impossible. This sudden loss of mobility is devastating because it robs the patient of their ability to travel, get outside, and just enjoy their remaining time with family. Now, what's really interesting about this next point is how it totally contrasts with the medical reality. When someone is sick and losing weight, the immediate, completely loving instinct of family members is to say, you have to eat to get your energy back, right? They might cook their loved one's favorite meals, maybe push them to take just a few more bites. It absolutely comes from a place of deep, profound love. But here is the critical medical context we need to understand. The second major symptom is ascites, which is a heavy accumulation of fluid in the abdomen. This fluid takes up so much space that it literally crushes the stomach. Ascites physically prevents eating. Forcing a patient with severe abdominal fluid to eat doesn't give them energy. It actually causes severe vomiting and immense physical suffering. So families really have to adapt to the patient's actual physical capacity in that moment, rather than unintentionally causing harm by pushing food. The third major symptom is pleural effusion. This happens when the cancer spreads to the lining of the lungs, causing fluid to accumulate right in the chest cavity. This fluid buildup restricts the lungs from expanding, which makes breathing incredibly difficult. Patients often describe it as feeling like they're drowning on dry land. The distress can get so severe that they might even have to sleep sitting straight up in a chair just to catch their breath. Let's look at Section 4, Managing Pain and Symptoms. Witnessing these symptoms is undeniably hard, but let's talk about how modern palliative medicine approaches these exact challenges. Because doctors are not helpless here, and knowing the tools they have can bring a ton of comfort to both patients and families. Medical teams have a really robust toolkit to ease a patient's suffering. They can use diuretics and albumin infusions to help reduce that severe swelling in abdominal fluid. They have powerful medications like morphine to effectively manage physical pain. They can even prescribe psychiatric medications to help alleviate the profound anxiety that naturally accompanies severe illness. There are multiple, highly effective ways to ensure the patient's comfort is always front and center. I also want to carefully address the final tool on that list, sedation. Sometimes, when pleural effusion makes breathing feel downright impossible and life expectancy is measured in mere days or even hours, doctors will use sedation. It is absolutely crucial to understand that this is never used to hasten death, not at all. Rather, it's an act of deep medical compassion, used solely to relieve the absolute agony of respiratory distress. It simply allows the patient to rest peacefully in their final days. And this brings us right back to the core theme of our explainer today. Knowing these medical realities in advance is such a powerful tool. It allows a family to pivot away from panic, away from confusion and the fear of the unknown. Instead, they can focus entirely on providing pure comfort, making the best possible medical choices, and really cherishing their final moments of connection together. Preparation literally transforms fear into profound, focused love. Finally, Section 5, the power of early prevention. So let's smoothly pivot our focus away from end-of-life care. While we absolutely must know how to navigate the end of the journey, we're going to close this explainer with an empowering, proactive call to action. Because the crucial point is this: while we must be deeply prepared for the worst-case scenarios, our first and absolute best line of defense is catching this disease before it ever has the chance to progress. The ultimate goal of learning about the harsh realities of late-stage ovarian cancer is to motivate us to avoid this journey entirely. Regular gynecological checkups, paying close attention to your body, and early intervention, these are your strongest shields. Which brings us to our final point, and a question I really want to leave you with today. When was your last gynecological screening? If you don't know, or if it's been a while, please let this explainer be the push you need. Establish a relationship with a primary gynecologist, listen to your body, and protect your future. Thank you so much for joining me today for this explainer, and I highly urge you to share this vital information with the women in your life. Stay informed and stay healthy.